Okay, thanks everyone for joining. We're going to get started now, and some people will likely trickle in. We are very excited to have another What Works Cities Community of Cities office hours, and we have Regina Schwartz joining us today. She's the director of New York City's Public Engagement Unit, and she's going to be talking to us a little bit about a new outreach model for government engagement that they've been doing with the cool work there. So a couple of notes. Please remember to put yourselves on mute. I will try and catch you if you come in and you're not on mute, and I apologize if I silence you. We will have time for a Q&A at the end, so hang on to your questions. You can also send us questions through the chat box function if you are joining by computer. And last note is that this is being recorded and archived for our community, so no need to furiously take notes or anything. We will be happy to share this with you later. And with that, I will pass it off to Regina.
Great, thank you. Okay, let's see. I'm going to share my screen. I'm just going to share it like this. Okay, we'll take it from the start. Can you see that? Are we good?
Looks good.
Okay. Hello, everyone. Thank you so much for joining, and thank you for having me. Basically, we're going to talk a little bit about is the work that we do at the New York City Public Engagement Unit, and you can reach out to me if you want to talk more after this discussion at our schwartz@cityhall.nyc.gov. So please feel free to shoot me an email if I cover anything too quickly, or just to share and follow up afterward. Basically, I'm just going to cover a little bit about kind of the state of play that we are in as a society, how the New York City Public Engagement Unit is trying to address some of those challenges, and how we work in New York. I'm going to talk a little bit about the tools that we use, many of which we can share with you guys, and we're happy to do that and talk through anything that seems like it may feels too New York centric. There are certainly lots of cities we've talked to that are thinking of building similar infrastructures to what we have. And so we have some tools that we can share, and we're also open to creating others that the community wants. And at the end, I want to make sure that we have some time for discussion, because I know this is what we're doing in New York, but there's so much that other cities are doing that we can benefit from, and that everybody on this call can benefit from. So not just a discussion about what I'm proposing, but everything that you guys are doing in your cities around engagement and service delivery that we should all be learning from each other. So think of those questions as we go along so that we can have a fruitful discussion back and forth afterward. So here's just a little video of some of the sentiment, I think, before this last presidential election.
I think government people don't care about America anymore. I think they're more interested in the next election and less interested in what's right for the country.
I'm supporting Donald Trump because he is an outsider and he's not an establishment politician, and I want somebody to come in and drain the swamp, get rid of all those career politicians who have just been milking us for money and votes, and they don't care about us once the election's over. We need a president that cares about the common people.
So we saw a lot of this after the last election, and you know, what happened? So people elected this guy, and his first budget basically cut the services that many of the folks in that type of a clip and that you heard around the country actually needed. Folks that were saying government doesn't care about me actually saw a big cut to a lot of the services that were in fact the government caring about them. So, you know, what happened there? Was it that government, federal, local, otherwise, wasn't actually reaching out and helping them? Was it that government was helping them? They just didn't know it, which this little clip kind of highlights the what if I told you Obamacare and Affordable Care Act were the same thing, then it's changes people's minds a bit. Or was it that government was in fact helping them, just people didn't feel engaged enough to want to invest and build up government? So I think that from a city's perspective, we are touching people the most. We're government that relates to individuals the most directly. We provide the most direct services. We are seeing them every day. And so we need to step back and tackle that problem a little bit. It is certainly real, and we're here at the front lines making sure that people move from government doesn't care about me to government impacts my life, okay? To I can access government if I need something, I know who to contact in government, to I can impact government. Something needs to change and I know who I can talk to. Somebody's listening to me. I can impact it. It's a two-way street. And hopefully it moves on to, okay, I am government and I want to lead government. So what we focus on at the Public Engagement Unit is this. The first step is the government doesn't care about me to government impacts my life to I can access government. So what do we do here? Now we were started 2 years ago, a little bit more, before the current situation that we have. We were brought in under the understanding that in New York City, there was a lot of people who weren't receiving the services that they needed to survive in an ever-changing, ever-gentrifying city. What we needed to do was go out and find the people who were the most vulnerable and make sure that we were actually connecting directly with them. There are lots of wonderful community groups, faith organizations, and they do a great job of plugging individuals and constituents into the overall system. But there's also hundreds of thousands of folks, if not more, who are not plugged in where they need to be. And it is our responsibility to make sure that they have access to the government services that they deserve. So what do? We go out in the field, we are knocking on doors, we are sitting with people in elected offices and in their homes, we're talking to people out on the street, and we're making sure that we provide that bridge between the most vulnerable and the city. Our core work falls under three main buckets. Our Get Covered team does healthcare enrollment. We work with health and hospital system to find folks that we believe are eligible for insurance, but who are uninsured. And we follow up with them using that smart data and other data from across the administration to enroll people in healthcare through phone calls, door knocks, community events, elected engagement. We have our home support unit that connects people to housing. They work with landlords across the city that wouldn't otherwise think to rent to people with vouchers in the shelter system. We work with them, we build relationships with them, we case manage so that if there is a vacant apartment and the landlord is willing to rent to somebody with a voucher, with multiple types of vouchers as you do in your cities, then we match them with a family in a homeless shelter working with our shelter services so that we can case manage that family from the shelter into housing and hopefully help them to live continuously in that permanent housing. We also have our tenant support unit that knocks on doors across the city to make sure that people who are at risk of eviction, either because their landlords are raising their rent at an unlawful rate or aren't making the appropriate repairs or are unlawfully evicting them, have access to the legal services that the city provides. Through this program, we've been able to help tens of thousands of individuals stay in their homes and not enter the shelter system. We do that through a regional door knocking team that has folks who are from those communities, speak in the languages of the individuals that they're talking to, and really reach those folks. Now, in addition, we're working on adding to our core functions lots of different services that individuals are eligible for. So our Mayor's Office of Operations team is building a tool called Access NYC, and I know that there's other tools across the country that allow people to be screened for dozens of city services, federal, state services, by clicking a few buttons through an interface. And from there, we can help them make sure they get everything they're eligible, not just the things that we're screening them for at the door. So we knock on doors, we make live calls to targeted lists, we attend community events, we partner with groups, we do high traffic flyering, and then we case manage folks and follow up with them to make sure they're actually getting the services that they need. Here's an example of one of those interactions.
Hello, my name is Alex. I work with the City of New York.
Hi, I'm Iris. Nice to meet you.
We're just doing street outreach today, just to let you know we're from Get Covered NYC. It's a city initiative to help New Yorkers get health insurance. I'm not sure if you have it or it sounds like you would be either eligible for Medicaid or an essential plan, maybe like $20 or $0, no cost a month for a premium. But we can take a look at that.
Yeah, sure.
Okay, awesome. So I would make an appointment right now. Along the way, we will be helping you. So just reminding you of your appointment, what documents you need to bring in. That day, if you want to schedule it, something comes up, we can call you. You can call us just to reschedule that. Checking up on you after your appointment just to make sure that you got the health coverage and care that you needed. And again, we're here to help you with the whole process.
So there's a couple things that you saw in that video that are interesting and unique, right? We have folks knocking on their doors, and we're doing this off a smartly targeted list from our public hospital system. You see our folks are using iPads. They can do an intake right there on their iPad, which will notify them to follow up in a couple of days, where we will call them and make sure they have all the right paperwork to go to their appointment once we've matched them with their close certified enroller. And then we can call them back to make sure they attended their appointment. And then after that, we can make sure they're actually going to the health and hospital system and getting the care that they need. During our little more than 2 years of existence, our teams altogether have knocked more than 200,000 doors, made over 1 million phone calls. We've helped 14,000 people stay in their homes who are at risk of eviction. We've moved over 6,000 clients out of shelter into housing. We've enrolled tens of thousands of New Yorkers in a variety of city services. All of this helps to save the city money. Every family that we keep out of shelter saves the city costs, as well as money to the health and hospital system, and move somebody from shelter into housing. As you know, it's less expensive to house someone permanently than it is to keep them in shelter. And we've helped move the needle on some of our citywide homelessness initiatives. And lots of folks have taken notice, not just in our city media, but we just did a national call with other cities about our Affordable Care Act work, so that other cities could replicate the, since we're seeing a cut in outreach on affordable care and lots of people don't know that they can still get it, thankfully we still can, cities are figuring out how to run their own outreach programs with their smart data to supplement the diminished outreach and messaging from the federal government on affordable care. In addition to other cities taking note, because our team is as effective as it is, other city agencies want in on it. So we add capacity when there are important issues to make sure New Yorkers know about. Now that DACA needs to be renewed so quickly, we've had our team out in the field. When there's emergencies, our team plugs in to recruit volunteers and act as staging location captains. When our summer meals program needed to get more folks making sure they were accessing the free summer federally refundable meals, we were out in the streets adding capacity that way. Here's a consumer affairs one. When there was a outbreak of leptospirosis, which is a rat-borne disease, we had our team out in the field making sure folks had the information they needed, because we are a unit whose job it is to talk to people and educate them and make sure they feel that relationship between the city and government. And so we are the folks that go out and do that. We also work directly with different agencies to help build up their own in-agency capacity through trainings, outreach, team building, survey management, tracking tools. Okay, so how do we do it? And like we said, we have built our own outreach program that directly assists people, and we've got a large team, and we're able to manage different projects with very specific goals through city staff. Now, there's other ways to do this. If you're looking at, for example, the Affordable Care Act, and I'm talking about it because it's prime on all of our minds, there are lots of groups on the ground that are in your cities that are able to give you volunteers to do phone banks, that might be able to do some of these door knocks for you to help you leverage their capacity, their data, and their technology to do a lot of the same things that we're doing without necessarily hiring the staff if that's not in your budget or ability. You can also develop paid outreach, which we do. We've got signs all over the city, digital, TV, otherwise, and we do a lot of earned media where we have press conferences, where we tell stories of people who have been helped. We know how important it is to actually get a story of someone like you being helped in your community, makes it more likely for you to share it. We do a lot of ethnic media. We want to make sure that those messages get out there as broadly as possible. So the way our team is structured, we have an outreach manager that is in charge of one of our initiatives. For example, you're looking up here at outreach manager. It looks that might be for our Get Covered team. Under our Get Covered team, you have a team lead. That team lead manages a team of specialists. And then we have multiple outreach managers for our core focuses. We've got policy, data, operations to manage the team that we have. We also have significant resources that we can share with you, how our scripting works, our do's and don'ts of canvassing, our canvassing best practices, our follow-up best practices for building connections and intake. We have a Get Covered NYC one-pager that's got a lot of the resources that you, it's actually more like a 5-pager that you can, we're happy to share with you. You should also think about how you can leverage existing data sets to make something like this work in your city. So you've got the public hospital system for us has information on consumers who use the system but exit without insurance. And that helps us do targeting that really kind of only the city can do. There's other social service agencies that for specific outreach, you may be able to use their lists across the administration. There is public Medicaid data. We have 311 information that's geographically based that we can go target specific areas based on large volumes of complaints. Maybe there's housing data, there's cross-administration data. You can also look at outside data sets. There are data vendors that will sell you data. There's groups that have built models that you can purchase. You can work with outreach organizations, like I mentioned, or advocacy groups that have reach into communities that can help you do high-level targeting, or other groups, like I was talking about some of the healthcare groups that actually have some of the data sets that used to be with Enroll America that can help you do some targeting of folks that are either need to renew their health insurance or are eligible. There's also publicly available national data like New York Times maps that you can see here, and those are on some of the handouts that we have. If you're interested, I'm happy to share those with you. When it comes to technology and case management, we've really done a lot in terms of building up tools. We've got a systems integrator that we're about to be launching that helps track each contact and each outcome and keep urgent action items up at the top, help us schedule follow-ups, help supervisors see how teams are progressing. It looks something like this. As you can see, we've blocked out the names of the individuals, but you can see how a specific case might have been brought to our attention, when our next follow-up is, when our last follow-up was, if we've referred it, and we can kind of track the overall progress of the team that way. We also have a canvassing tool where we can actually see turf to assign and make sure that people are knocking on the doors and they're able to actually enter those cases on site with offline functionality. We have a home tracker system where we are matching landlords to providers and shelter to families that could actually use their vouchers in those specific places. And we can manage the supply side as well as build relationships with landlords. And the home tracker helps the multiple government agencies and also NGOs collaborate to move people out of shelter and into homes. Technology and field work. Every specialist got a phone with a hotspot capability, and we use iPads to canvass, which is actually, as you know, something that's not typically done, and it allows us to really keep that data smartly, and especially if it's confidential information, to make sure that we are keeping it in a secure place. We do a lot of text messaging outreach. This is an example of our text messaging around Get Covered. People can text Covered NYC to 877-877, and they will get information back to them about where they can actually go to get in-person enrollment assistance. We're talking about the Access NYC tool, which we will be carrying hopefully in the field soon, where we're able to find out all the things that are that people are eligible for, and we'll look for ways then to connect them to those services and help them enroll. Would also suggest that you think about things like hotlines. We have hotlines for each of our units. You can call 311, which is our information line. I know multiple cities have that, but if not, we have hotlines that direct people specifically to our outreach team so they can be kind of case managed and follow up with pretty directly. And there's other groups like NYC Well and NYC Domestic Violence Hotline. Lots of groups have set up these hotlines so people can be specifically targeted to the service that they need. Like I said, you can set up text messaging with geo-tracking to find the nearest enrollment location, 311. One thing that we like to do, and I'll talk about this a little bit later as well, are things called teletown halls. I know that this is maybe about a year old for the city to be using, although lots of folks have used it. Basically, in a teletown hall, you dial out numbers of your constituents, phone numbers to their home using the data sets that you have in the city. And people pick up the phone and it says, please stay on the line to have a discussion about, for example, senior rental increase exemption, which is one thing that we have in the city that people need to sign up for to freeze their rent. You'll be placed in a live call with the mayor of New York, and you'll be able to ask questions with him and subject matter experts throughout the call. And then it operates almost like a radio show where the mayor will give a few up top remarks, describe eligibility, and then people can actually be live on the line saying, I'm this old in this area, how do I get this service? Or here's my specific question, here's my specific issue. Then we follow up, and it really allows, we've had 10,000 people on a call. We're also able to let people dial in, and it really allows kind of for that two-way back and forth. We also do robocalls in multiple language to help schedule appointments, as well as get people to indicate that, yes, this is a service that I am interested in. They can either be immediately connected to someone who can help them. We can give them a phone number to call. And you can imagine for us, we do that with our teams, but you can imagine also doing that to another organization in your city that can help them enroll in that service and kind of being that bridge and that connection that gets them what they need. We, like I said, support outreach with dedicated paid media. These are some of our, here's a Get Covered ad on the left. We've got talk about your rent regulated building, freeze your rent. The home support team is part of our home support unit has lots of different components, but one thing that they do is they connect families who are doubled up in the education system and they who are at risk of going into a shelter, and we help them either pay their back rent or help them get a voucher to be in an apartment for themselves so that we can hopefully them and their family stay stably housed, especially during the school year. So I know I covered a lot quickly there and I spoke faster than I necessarily needed to, but I want to make sure that we have time for the Q&A part of this. I want to play one video here, which I just love, and I have it in this portion of the presentation because it is, I would call it earned media. Our video team produced it for one of the folks that we got health insurance for.
Hello. How are you? Wow, that's unbelievable. I was unsure. I had to go to the emergency room. They sent the emergency bill, and it was like over $1,000-something. I'm like, why? Thank you, because you really, ease my burden.
I don't get to meet a lot of because I call it. It's actually the first time I met with and my meditation. This helps me a lot to continue to do what I'm doing. That's helped me feel better for what I'm doing.
So we share videos like that and story individual personal stories within communities so that folks will reach out if we're not reaching out directly to them. So we're trying to bring people, we're trying to get them the services that they need to live stably in the city. And I think that brings people from government doesn't care about me to government impacts my life. And then we also, after we knock on somebody's door, we give them the actual card of the individual who spoke to them. And they can call and follow up and make their voice heard and ask for additional services that they need it, if they need it, and share that card with others in their community so that people who need the services of the city can easily access them. And then we also want people not just to be able to access, but to say, hey, I want this in my community. And so we invite folks to attend town halls if the mayor is there, to attend other meetings where they can make their voice heard in their community. And then, at those meetings, they're often plugged in with different community groups, and they hopefully become more engaged overall as they see that relationship being real. We provide them a voice for their concerns. When we have lots of folks saying the same thing, we make sure that people in the administration definitely know about it and are able to address it and get people the answers that they need to a specific issue. Because we've been able to help them get the services that they need, we become that trusted touch point in government. And as I mentioned, we try to facilitate other forms of touch points as well as being in the community and working with elected officials' office and community-based organizations. I would also just want to mention that after Trump was elected, we got a lot of calls in from folks who wanted to know what it meant for them in a city, and that was an indicator to us that people did feel that they could call and trust us and ask us the questions that they need to have answers to. And we are one of the avenues that they go to. They've had the phone number shared with. And then hopefully they move up this ladder and they think of themselves as a part of government, and that government is something to invest in and grow, and civic engagement is worthwhile. Here's another video. This is also around Affordable Care Act because we're in such a moment here, but I just wanted to play it of a story from one of the press conferences we did after we kicked off the initiative.
About 3 days later, my health insurance was cut off. Días después de ser diagnosticado con cáncer, Wellington Pellerano perdió su cobertura médica. Gracias a una iniciativa de la ciudad, hoy puede recibir su tratamiento. Consiguieron mi información por el hospital Lincoln, en el Bronx. Me contactaron, me preguntaron si tenía seguro, le dije que no, y ahí comenzó mi proceso.
So this is another story of somebody that has been helped, and there's obviously hundreds of those. I wanted to share one video with you there, but there's certainly more if you want to see more human examples. I think that I know this isn't the only type of outreach like this that is happening either in New York or in other cities. We've got a great team that does pre-K enrollment, and that's where our team grew out of. And now we are doing more things out in the community, on the doors, and talking about not just one specific benefit, but many benefits. And I hope that what we've talked about today is helpful to you, that there's tools and technologies that you're interested in. I've got a member of my data team here, our data director, who can answer also data-related questions if you have them. So let's have a little discussion in terms of, do you do this in your cities? Do you think you could do something like this? What are the best practices that you've come across? What would you need to accomplish these similar goals? What kinds of toolkits could we provide you that would be helpful? And what would you just like to share with this group and others that you found has worked or haven't worked in your community? I'm also happy to obviously answer any questions that you have about the way we do it here, or the way that we're growing, or any of the other citywide or multi-agency initiatives that we've kind of plugged in to work on, just because of our expertise around engagement and outreach. So yeah, thank you.
Thank you so much. It looks like we did get a question in the chat box from Katya. Katya, are you online?
Oh, sorry. Can you hear me?
Yes, hi.
I was still muted. Hi, I was just wondering, you mentioned toolkits and the best practices and scripts. Where can we find those? Are they public? And if not, which toolkits are you currently working on?
Yeah, so we have one pretty good toolkit around Get Covered NYC and the Affordable Care Act. We have, we also have other things that we could share, like some of the scripts that our team uses, and more detail about our team structure, outreach tools and technologies that you guys can model off of what we do, our workflow streams for things like text messages, or our templates for our paid media. Those are all things that, you know, we could share if there is an appetite for them. It's the reason that I'm doing this presentation is that as I frame it up top, I think we're in a moment where we all as cities need to step back and say we need to make sure that we are connecting with our constituents and providing those who are part of the system, not only with the services they need, but with that connection to government. That is so vital to increase civic engagement and investment. And we all believe that as cities, no matter what party we are affiliated with, as people in government, we believe it's our duty to serve and to engage folks in that process. So one of the reasons for doing this call is to actually hear what parts of our work would be useful to you, and then begin to develop toolkits around those areas.
Hi, this is Katia. Yeah, that sounds really great. I think in particular the scripts and the outreach tools you used would be really helpful, because I think I'm with the Sunlight Foundation, which is a partner of What Works Cities, but a lot of the cities that I've spoken to are kind of unsure about where to start. So that might be helpful.
Great. Any specific parts of the toolkit, just everything in general, or?
I think the team structure resources that you mentioned, and then whatever you think is best for cities that may not necessarily have a public engagement office, but want to start with reaching out to target stakeholders.
Great. I will do that. And I also want to flag, part of the great thing about New York is that we've got a lot of different teams. We have a community affairs unit, which has been around for a while and is great. And they work with more of the stakeholders, clergy, tenant organizations, community boards. And so we have that work that they do, and I'm also happy to connect you with them. And then our work is kind of the more direct to individuals who aren't otherwise engaged.
I have another tool that I'd be interested in. This is Annie Bierbauer. I'm from the city of Fort Collins in Colorado. Can everybody hear me?
Yes.
Okay, great. I am interested in how you kind of determine how many people need to be on the different projects or even areas of the community. How do you kind of know what kind of manpower you need, or like maybe this is in your best practices, how many people go to the door and people still feel not intimidated and all that kind of stuff. And we are our city is considering some sort of a community trust resolution that's in response to a community action group proposed community trust ordinance. And we're putting forth a resolution, but we're really wondering how we can do education around that and really connect our police force to this population and build trust there. So any tools around that as well.
That's great. So yeah, we have, in New York, we have kind of a community policing structure, which is it's a throwback, but it's also somewhat new. And so we really built that police community relationship, and I can connect you with people who work specifically on the police community side of it. I would say on the first part of your question, yes, there's pretty good formulas for how many people you need based on the goal that you're trying to achieve and based on the targeting that you can do. And you always start off.
Awesome.
Yeah, you always start off needing to know what your conversion rate is. How many people do I need to talk to in order to deliver XYZ service or turn XYZ people out to a meeting if I want to have a robust community meeting around a topic. Then you have to dive into your data and see, okay, do I have individual level data, which means I pretty sure that my target is interested in the thing I'm talking about based on their income or their other services that they're receiving for the city? Do I just have geographically based? And how dense is that? Should I be doing phone calls, and how many phone numbers do I have? Should I be just blind door knocking? And how many people do I bring home, and when am I doing it? And what are the languages that they speak? Those are all things that we take into consideration when we develop these teams. And, we try to build them leaner than necessary. And then if we see, okay, we're actually having really good success at this, and we're saving more money than we're costing, or we're really delivering these services in a way that's impactful, can grow to meet that demand. But we can talk you through it, and we can also try to add that to the tools of how do you justify the correct amount of people to meet the need.
Okay. Yeah. So do you have any of those, you said conversion rates or the formulas that you use? Is that something that could be added to the toolkit?
We can yes, we will describe it. It's usually different depending on the city and the difficulty of enrolling in that thing. There's a lot of factors there, but we will go through the normal variables that we include in that calculation, and we'll put that on our list for adding into a kind of toolkit.
That's great. Thank you so much.
Yeah.
And should I follow up just emailing you to get the connection to the police force communications person, or what's the best way to do that?
Yeah, email me. My email's here at the bottom, and then we'll connect you the right way.
Okay, thank you so much.
While people are thinking of questions, I'd also love to hear things that work in your cities that we should be adopting in New York, or anyone else on the line.
I had an idea. I guess we haven't done this yet, but it sounds kind of similar to what you've done. We just recently did our first telephone town hall, and it was for community involvement with the budget. But the people that we had communicate, or the leadership, I guess we had, was the city manager, the chief financial executive, and the mayor. And I was thinking it would be a great idea to kind of shift that a little bit and have a telephone town hall, but more based on questions about resources. And so we can maybe have somebody from neighborhood services to talk about neighborhood grants, somebody from social sustainability to talk about applying for their financial aid services, maybe somebody from the public engagement office that could talk about those just ways to be more involved in that. So kind of shift the way that we use that a little bit. It sounds like that's something you guys have kind of done already too.
Yes, we do that a lot. We do it with the mayor, and then we do it with other city officials. For example, we just did one on the DACA renewal with our acting immigrant affairs, and we just kind of went to areas that we knew in general had a large population that might need these services, and people could get their questions answered right there. For things, we also do it a lot with the mayor. We did one on enrolling in healthcare, and in the room, of course, we have people who can answer the questions on federal policy, who can answer the local questions, who can answer the health and hospitals related questions. And one thing that's really cool in a lot of the teletown halls is people can answer a survey. So what we'd like to do is, if you need individual help enrolling in health insurance, press 1 on your phone, and we will call you back. We say in the next 48 hours, because we have the capacity to do that, but you can say no in the next week, and make sure that you get information about enrolling, or that we are able to enroll you right away. So I would add that if you're not already doing it. And we've done this on topics from rental assistance programs to election reform to enrolling in, I think we did one early on in enrolling in pre-K. There's so many different issues that you can you can give information about how to get, we did it for homeowner tax exemptions, for enrolling in housing, affordable housing, and how you could make sure you're getting affordable housing. So there's really a lot, and that kind of push one to get a call back has let us more targeting around it, and people, we'll have in the room 3 or 4 different commissioners, and they can answer questions on exactly the question the person has, and that's often the question many people on the call have. So it worked well.
Cool. Thanks again.
Who else has a question or a comment? Do people feel like this is a feasible model for them? Do you feel like you need more support on it, or more something that wouldn't work in your area, and why? Or do you have something similar or a little bit different that does work?
We have a question in the text box. Let's see, I'm not sure who asked, but they said, what are the top 3 public engagement initiatives that work best for New York?
So, our public engagement unit was started specifically around housing. One of the biggest issues in New York City is access to affordable housing, and there's a lot of areas that are being rezoned with the goal of preserving affordable housing and making sure that, as things are being gentrified, that it's folks who've been there do have protections, and that the community is getting real infrastructure that benefits the folks who have been there for a long time and made their lives there, and their families are there. So one of the initiatives in those programs was to make sure that people weren't being displaced by landlords who think that they can, get more money from a new group of folks moving in, and are using tactics that are unlawful to evict folks. So that's where we started. And this mayor is an organizer at heart, and he really believes in going directly to the people. So he started this as a small team that would work knocking on doors and making sure that people had the eviction protections that they are entitled to, and are connected directly to legal service providers and case manage and follow up with. And then similarly with our the homeless issue that we have in the city, we needed to make sure that folks who are in shelter were being able to find permanent housing. And so that's when we added on the home support unit almost simultaneously with our tenant support unit, really working with landlords, really building those relationships, giving them incentives, and working with them to get people who are in shelter and have the vouchers and the ability to move out into those homes. And we have beautiful pictures, I should have included them here, of people getting the keys for their new home, and veterans who have been in homeless systems for a while, who are able to actually meet up with landlords themselves who had been veterans, and now they are, moved out of shelter into their home. So those two teams kind of grew up around some of the city's key initiatives. And then when we saw actually that our health and hospital system is, of course, treating all people who come there, but there were a lot of folks who were using the system, and the hospital was not being reimbursed because those folks just weren't applying for their low and no cost free health insurance, just because of the paperwork, and they might not have known where to go to get it. They didn't know where the appointment was, or they missed their appointment. And so the thought was, okay, you know what, if we can enroll a certain number of people in health insurance, not only will the program cover its own costs, but we'll be able to get significant reimbursements to our public health and hospital system, and get people the health care and the wellness visits and the reliable care that they deserve. So that's where it's kind of grown up. I would say, as I mentioned before, there's also a pre-K team that does mostly phone outreach to people with children that could be eligible for our universal pre-kindergarten. That works well. The city has a Thrive team that does mental health. That's not part of PU, neither of them those are, but that works with people to educate them on mental health and refer them to the proper services. So the city is really taking outreach aggressively, but for our team, those are our top 3 core function areas. But as I said, whenever there's something that's kind of short term, like the DACA issue, or we're prepping for an emergency storm, or the summer meals program, or when our NYC service team wanted to do a survey about why people were or weren't volunteering, we had the tools and the technology just to help them with their branching script logic, and help them launch canvases out in the field. So, we plug in wherever we are needed, or when they were doing some changes in our public housing system called NYCHA, we went and talked to people about those changes and made sure that they were aware of them and they were then attending the meetings. So we drop in, aside from our core areas, we kind of drop in wherever the city needs additional help for a short term. And then if it's clearly a longer term project, we work with those agencies to see, okay, how can you build the kind of outreach we do directly into your program if it makes sense, because we've been doing it for a while and we can build it there, or okay, what we really need is a formal group who spends their entire time doing this outreach, and then we work with them on how to build that. A long answer.
Thank you.
Anybody have any other questions? Did I cover it too fast? Any of these other tools that you would be interested in? Or I think I see a chat question.
Yeah, for those on the phone, it says, in terms of technology, what tools have helped you the most for engagement? For example, we use SurveyMonkey for surveys.
Yeah, we're building this larger canvassing tool that we're building is based off of a Salesforce platform. We've also spent a lot of time building our own kind of internally with our Mayor's Office of Technology. We kind of created our own survey platform for the most part. Am I missing anything that you can think of, Bridget?
Those are the main case management systems.
Yeah, those are the main ones that we use. Yeah, we've got just vendors that we use for robo and text. I think there have been, we've had to do some stuff in Excel when we first started out, but I would say you got to quickly move past that to make sure you're keeping track of your volume and making sure nobody falls through the cracks. And we use Facebook targeting for digital ads sometimes, geo-targeting. Yeah, and we've used Civis Analytics for some of our data needs as well.
I have another question about offering resources in different languages. Do you have any best practices or methods that you use in terms of determining what you need to provide in the different languages, and what are those data sets that you turn to target those languages, things like that? We usually use, since census data is typically so far apart and a little bit outdated, we turn to our local school district that does an annual report, and so we base a lot of our language needs off of the language needs of the school. But yeah, wondering what you guys do.
That's great. I mean, so I'm going to toss it over to Bridget, who can scoot over here, who's our data director, a little bit more, which is why I wanted to have her in here. So thanks for asking that question. But also, in terms of languages, just top line, we have, I don't know, at least a dozen languages, I think, spoken at PEU itself. We try to hire people who are from the areas that they're knocking, or at least have the language capacities that we need. We just did an event yesterday, or 2 days ago, with a group that services the Asian community, and we had a Fujianese, Mandarin, Cantonese speaker there because we know we need all of that in that community. We do a lot of work in Spanish-speaking communities, so we make sure that we're out there. We often partner with our mayor's Office of Immigrant Affairs, and they, of course, also have a lot of languages. But it's definitely a priority of ours to make sure that no matter what language you speak, we can answer those. We've got Bengali speakers on staff, Urdu, a lot of all of them, and then we do it. I know based on geography sometimes, based on community groups sometimes. One thing we like to do is here's Bridget. One thing we like to do is do it like a robocall that's in 2 different languages or sometimes 3 different languages, where you can push one to hear it in another language, so that even if we're not sure, we hope we're catching most of it. We've done teletown halls that are simultaneously translated into one language. You probably do it into a couple, but we haven't quite done that yet. But Bridget, what do you think?
Yeah, so we've also used our Board of Education data to utilize last names of parents, and then extrapolate from there to apply it to the rest of the folks that we're reaching out to try to predict what their language of choice would be. But we also have collected, with all of our case management work, we make sure that when a specialist who only speaks English and Spanish, for example, gets on the phone with someone who is Bengali speaking, we try to record that language information as well, and then utilize that to improve our targeting. We're working with, Regina mentioned that we work with Civis Analytics, so we're working with them to get to develop a more sophisticated language targeting model as well, so that we can better target from there.
Does that begin to answer it? Or any other?
Yeah, thank you.
Great. Any other questions out there? Just answered them all.
I have one more. Sorry, I keep on waiting to see if somebody else is going to say something, but so anybody go. Do you have any advice for how to make kind of an expectation or just a foundation of public engagement systematic inside of your organization?
I love that question. That's like, you're thinking next step. How am I going to get it?
Next webinar?
No, it's good. I honestly, the honest truth is that it really works. So once first of all, it really works. Second of all, at least if you're in New York, or I bet it's other cities, people are just looking for resources and opportunities to service more people than they are right now. We're all in these jobs because we're passionate about making our cities work for our constituents. And so the moment that, I would go to a meeting with somebody and say, look, here's what we're doing around housing. We're finding people and speaking to them directly, and we've been able to help this many folks, and we're not dropping the ball. We're getting it done. And we're using smart targeting and data in these various ways. They usually light up and say, wow, okay, let's try it a little bit, or let me see how it's done. And we can take them on they can shadow. We can show them our tools. As soon as they see our tools, they get excited about it. We kind of spread through word of mouth when somebody, luckily we have buy-in from the highest level. And if he sees a place where he thinks we can add value, he'll normally, look to us and plug us in. But otherwise, we've actually found that there are folks who really do see it as the opportunity that it is, this type of work, and want to test it a little bit and then want to drive it home. So I guess I would say, find something that the city is really in desperate need of outreach on, demonstrate, and we'll be happy to help you demonstrate the power of building that individual connection and then following up on it. And then you, I believe, will see more parts of the city being even more excited to work with you. There's also, I would say, start with something that, saves your city money overall, that you can show your team as a net monetary benefit. and then that's always helpful. And then move from there, and make sure that during the same time that you're doing media outreach, so that you're getting a message out to all communities, and celebrate your wins and all of your milestones. And I can show you how we've made the case a little bit, but the case kind of makes itself once you demonstrate the power of what you're doing. Yeah.
Thank you. That helps a lot.
We got 4 minutes. Who has another question in the 4 minutes?
Answered everything.
Mm-hmm. Okay. If you don't have any, if you have a question you just don't feel like asking it here, shoot me an email, or you can shoot the What Works Cities folks an email, and they can get it to me as well. Or if people on this call feel like they want something more, they want to really walk carefully through a bunch of tools, I can do that with What Works Cities, or we can try to talk in person if you are here, or if there's a conference that you're going to. I'm happy to come and be part of that.
Great. Thank you so much. This was a really great experience for all of us. We look forward to continuing conversations in different outlets. And if anyone on the line or on the video would like to be connected and would like us to help facilitate that, you can feel free to write us at info@whatworkscities.org, and we will also help you do that.
I'm going to Slack this over to you.
All right.
Thank you
so much.
Thank you.